laying Pilates progressions. So the assumption is that you've done the level 1 exercise that I set you. And if you haven't, scroll down, there's a link below, spend a good 3 or 4 weeks just really nailing the basics, learning to recruit properly, learning to do the slides, add them into your normal routines. By all means, progress them. But remember, the focus is on perfect execution and not the range. It's not the number of sets and reps, because I don't care about that. That will come with time. I want you to be performing it perfectly. Okay? So, in theory, you currently have centering and recruiting, where you gently engage your abdominals, you bring your weight into the back of your hips. Now, that's the bony part at the back of your pelvis. It's not your low back. And it won't be that easy to see, but here is me centered, and then here's me imprinted. This is me pushing my low back into the floor, and that's wrong. We used to teach that, but that's not what we're about. What I want is a balanced recruitment where your bones, your pelvis, your hips are drawn down. You're drawing the muscles together, and it's a shortening in the front of your body. You're not pushing your tail under, okay? So there's space under my low back. My shirt slides side to side. I'm not actually in contact with the table in my low back, because that's my normal arch. So when I say tummy in, I mean recruit the muscles, not push it downwards, okay? So I place my hands on my hips generally just to make sure that my hips are staying level. You've currently got single leg slides. So you slide down, slide in, and the focus is that there's no hip shift. Well, so to progress this, to start with, take the heels off the floor. It puts a little bit more demand on your hips and your lower abdominals. The recruitment is still, and the focus is still the lower abdominal recruitment, and there's no arching in the pelvis, no increased change in your low back. Okay? If that's comfortable, then come up to 90 degrees. Keep one on the floor, either heel grounded or heel lifted. And you've already done your single knee lifts, because we did those in video 1. So on this one, this should be a relatively comfortable range for you. And can you see, I can get to there, but if I don't recruit, when I go down, my pelvis tilts. And you see this in people doing gym exercise all the time. They're doing leg drops, and they're doing this. All you're doing is tilting your pelvis. That's not helping your abs. It's definitely not helping your back. You would get better results by putting the brakes on and using your muscles to stop here, rather than allowing momentum to take you past it. You'll get a greater stretch, greater muscle recruitment. It's safer. There is zero reason you wouldn't do this other than laziness. Okay? So focus on your controllable range of movement. And for me, that's there. I won't touch down because my hips are tight enough from what I did this morning that they don't want to go there. Do your number of repetitions and always start with the weakest leg. So for example, I will have done 15 by the time I finish here, if you've been going with me. Put it down, and we come to the other side. You do your 15. Obviously, you can scan forward a little bit if you're just listening to me to learn, but I'm going to do the 15 reps. So if you're following me through this video, you've got time to do at least 10, 15 reps. Obviously, if you're already progressing on to higher rep numbers like 15 to 30, happy days, just pause me. And if not, add a band and make it harder and stay on the lower reps. Progression. Press down into the back of the hips. Lift your leg up to tabletop. So we haven't done this yet. It's really important that you really get that center. Don't bring the knees into the tummy unless it's too painful. But I would argue if you can't have your knees at arm length, this is too advanced for you, because you need to be comfortable here. And you can hear that I'm talking. There's no strain in my voice. I can hold here all day. And your single leg slide progression is to just drop down and come through. Drop down and come through. Now, I'll often lift my arms up like I have here because there's a little bit of counterbalance. Can you see my foot stays above my knee? Look what happens to my low back if my foot drops below my knee. It just encourages that arch, and we see this a lot in classes. So feet high, knees at roughly arm length, alternate drop down. Want to make it harder? Multiple drop downs. Okay? Your progression would be to do a double. Lower down as far as you can go. You can see I'm actually straining a little bit now, but I can still go to roughly the same area. Watch my hips. Can you see I'm arching? you've lost the whole point of the exercise. Your abs aren't working properly anymore. All you're doing is pelvic arching and putting pressure on your lower back and on your nerves. So perfect execution for me would be stopping here. I always pause and then I come back in. And the reason to pause is so you've got time to recruit the right muscles to anchor through your shoulders before you pull back. Okay? So you can hold on, that's okay. Set, draw back. And if you only manage 1 or 2, that's fine. Do 1 or 2. And then put your leg down. Do your other 10 repetitions. And then switch. And do 10 repetitions. And switch. Okay? Because your 15 to 30 or your 30 to 60 seconds, whatever I've set you, can be a combination of any of those levels. As long as the focus is draw the tummy, press the hips, shoulders down, neck long, and we're trying to get that lateral thoracic breath. We're trying to breathe into the ribs and not into the tummy. But you know this from the other video, okay? So I'm not going to run over it. We've already done it a little bit. In level 1, you've got alternate knee lifts. A really great exercise to progress this is to walk to tabletop. So you anchor, press through your hips, press through your arms if you need to, and you walk to 90, 90, you tap, and you tap. If you want to make it hard, you don't put the heel down, and you have the soft kiss down of the toes instead of putting the foot flat on the floor. Okay? If you want to make it harder, what you can do is you can walk up to tabletop, control your abs, really take a moment, and slowly lower both down till the toes contact. Reset the heels, reset the hips, and walk up again. So we lower all the way down, strong stomach engagement. If this is easy, you want more endurance, do alternate toe taps, but from the top. And you could do singles, or you can do doubles. But again, remember, hip stability. If you want a little bit more, tap 1, heel tap 2, and lift up. So we're adding a little bit of lever change. All right? And again, the aim is 15 to 30 reps or 30 to 60 seconds of your chosen level. If you want to do doubles, you could heel, toe, lift, or toe, heel, lift. Now in the gym, hanging leg raises is this exercise hanging off a pull-up bar. If you nail this grounded, by all means, hold on above your head so you get used to the position. But if you can nail this grounded, then apply the same principle, that stillness, to a hanging leg raise, it just looks like a gym exercise, right? And that's the whole point. Every exercise you do in the gym is Pilates, and you've just learned to do it badly, potentially. All right? The last exercise on the laying Pilates that I gave you was single leg dropout. Excuse my gammy hip. The range is still a little restricted. Yeah? Progression, lift the heels. Single leg dropout. The weight's in the hips. There's no movement in my trunk through my torso at all. Progression would be to do both legs at the same time. So arms spread, pressing the shoulders down if you're on the floor, and just let them roll. Now, if you see, my feet are glued together and my hips are rolling. I'm not allowing my back to arch. All right? My back stays in neutral position. My pelvis is engaged. And as I twist, it's really important you maintain that pelvic neutral. As you progress through higher levels, you can allow an arch as long as it's deliberate. If you're allowing your feet to split, I'm only going just one way so you can see what my feet are doing. You keep alternating. This is more for your hips. This isn't really for your low back anymore. It's encouraging rotation through your pelvis. If that's your aim, happy days, this is fine. It's not wrong. It's just not what I set because my focus is the lower back stability. I hope that makes sense. So, heels lift, both legs roll. Keep that center, and for me, I can stop there. I can feel the strong pull through my abs. It's hitting into my obliques and my lats, but it's not making me arch. I can probably, oh, cramp. I can probably go a little further, but I'm really struggling to maintain that pelvic neutral. I'm going to brace, so inhale, exhale, and as you control that exhale, come all the way back to the center. And you'll find you're going to have to start to cue into your breath as we do these higher levels. At the lower levels, I don't really push it because you've got enough to think about. But as it gets more physically demanding, I would like you moving on your out breath, either with it or on a held exhale, which is anti-Pilates in yoga, I know, but for me it works. You are much stronger on your exhale because everything's engaging and drawing in together. All right? Progression. Come to tabletop. Set the knees just like you did before. Recenter, shoulders, neck. If it feels good to you, hold on above your head. Or strong T position. Or hold on to the side. Or even use weights to hold you to the floor. That's okay too. All right? There isn't a right and wrong as long as you're being safe. Single dropouts. Excuse my manky hip that doesn't want to work today. Out and in. When you're ready, double. Now remember, the whole point is there's no low back arch. Both shoulders want to stay in contact with the floor, please, but your spine can twist. So for me, it's there. I exhale and come back to center, and I go the other way. Inhale, hold. Exhale. Press through the back of the hips. Center. And if you want to make this harder, what you could do is you could, as you inhale, straighten one leg to increase your lever. Exhale to center. Roll. Increase your lever. And that pause is really important because as long as your focus is quality, there's no reason you wouldn't pause. It makes it harder. It makes it safer. It may mean that you get less reps, but as long as you leave your ego at the door, add the pause because your progression will be so much faster. Same as if you do pause reps in the gym, your strength will go through the ceiling rather than just bouncing reps out, okay? Meathead training versus science training. Last progression for this one for the moment, which would be straight legs. You could always go bent leg, straight leg, center. You can go bent leg, straighten, bent leg, center, or just straight. Come all the way through. Now, personally, I find this easier than doing the single bent leg. To me, other than keeping my shoulder down, I don't find this massively challenging, but I do a lot of lower abdominal work. So, to me, that stability is far more of an issue, but personal. Choose the level that's right for you. By all means, challenge yourself. You're out of that acute phase anymore. And I need you to stop treating yourself like you're made out of glass. You're not. Yes, you still have the injury. Most injuries are permanent to some degree, but it doesn't mean you can't challenge it as long as you listen, okay? So don't be afraid to try the new level and to fail. Failure is part of growth. And if you're not failing on a regular basis, you're not challenging yourself in the right way. I'd like to show you the full progression, okay? So everything we've just done turns into this. You lift up, you drop, you lift, you roll down. Yes, this is still Pilates. Can you see that I'm always in control? I'm never arching. The rotation is there. Those movements are all just been put together from what I gave you to what I do in the gym. I'm a little bit worried about kicking things in my studio, so please excuse me. But you take my point that these progressions need to be layered in. So I would do bench press, kettlebell shoulder press, lay down on the bench press, hold overhead, and do the single legs or the double legs or just the leg lift or the leg rotations. I'd then go on to my dumbbell incline press and I'd do a different variation. And I'd finish my whole routine by doing the big global movement at the end to practice. So over the whole session, I might just nail those 3 movements and that's it over a whole hour, and that's my core workout. I rarely do just crunches because that's all the abs you're ever going to need if you do them well. And that will mean that when you come to doing your sport, running, swimming, cycling, jumping, climbing, your core is so strong that your legs work with your upper body and the rate you get injured will drop through the floor. My disc injury has bothered me twice in 20 years. And I'm 100% convinced it's because I do stuff like this every day. Okay? Hands-on is so important if you're struggling with this in early phase. So come and speak to me and we'll do a hands-on session, or your local Pilates instructor. You want hands-on training, and Reformer is a great way to go as well. So if you need, reach out to me. If you're in my area, there's some amazing Pilates instructors around, or I'm more than happy to do a session with you to get you from porcelain and broken to bulletproof. All right, that's what this whole channel is going to be about, taking you to being a bulletproof athlete. I hope you enjoyed. Please hit me out with comments. If you enjoy this video, I'm planning on doing so many more, but please like it, subscribe to the channel, and if you can share it on your Facebook, your Instagram, that interaction pushes my channel up, but also shows me that what I'm doing is working for you. It's what you want to see. And the stuff that gets the most interaction is what I'm going to prioritize. So if you want more of this, if you want me to help you in this way, the best way you can do that is to show me you like it.